If you are struggling with depression, I can almost guarantee you that you have not looked at it from this perspective. A functional perspective is looking upstream, trying to get to the root cause of it. Is it just a chemical imbalance, or is there more? No, thinking positive won't help you just get over this. Let's dig into this today. Hey everyone, Dr. Pries here, and today's talk is all about depression. It also has implications for anxiety, other cognitive issues, schizophrenia, mental health disorders, cognitive decline. But depression, this is a not so radical solution to solve it permanently, and I mean permanently. When it comes to depression, what happens when we feel down? What do we normally do? You go to a medical doctor, your primary care physician, you get a diagnosis of depression, you maybe are prescribed an antidepressant, you may be sent to therapy. That's the normal course of treatment, but here's a disclaimer. I'm a holistic doctor, which means I'm looking at you as a whole person, and I'm trying to look at you from a functional perspective. So I'm not trying to look downstream at symptoms, at what is happening. I want to look upstream and see what is the root cause and how can we fix this permanently so you have long-lasting results, so you're not dealing with this affliction anymore of depression. And another disclaimer, I do believe that we're very complex beings. With every person, there's a trifecta of health when it comes to mind, body, and spirit, and all of these facets do play a role in depression. Today I'm going to be emphasizing the body part, which would mean the physiology and biochemistry which are occurring within the body of somebody who has depression. So I have to ask the question before we move forward. Would you rather get healthy or get medicated? Those are the two options you have, and I'm going to explain why. So, have you ever thought of depression as maybe a deficiency? Maybe that's what it is, because deficiency is highly implicated in depression. When it comes to the brain, there's three components of nutrition. There's the nutrition that leads to protection, there's nutrition leading to plasticity, but also supporting the brain environment. These are the three big components. So when it comes to what we eat, what we consume, the supplements we intake, we need to be supporting these three pillars. I'm going to dig into more of that. Some depression is hypohormonalism. That can be deficiencies of the thyroid, the adrenal glands, as well as the gonads. Okay? Some depression is truly deficiency, and that could be B12 deficiency, highly implicated in depression, folate deficiency, iron, B6, magnesium, zinc, and vitamin D, which is highly correlated with with depression and anxiety. You gotta remember, the foods that we eat in the standard American diet cause tremendous gaps in our nutrition. We're not getting all of the vitamins, minerals, and nutrients that we need in order for these processes to thrive within our body. And as a result, downstream, you're going to end up with conditions like depression, like anxiety, ADHD, etc. Some depression is actually linked with food allergy. The big four food sensitivities and allergies would be gluten, dairy, soy, and corn. Allergenic inflammation can exacerbate any illness, okay, because of its effect on the immune system, including but not limited to mental illness. The reason behind this is that there's these inflammatory cytokines, which are signaling messengers that can actually cross the barrier going into the brain and into the brain's environment, and this causes neuroinflammation, which is highly connected with depression. Some depression is actually toxicity, especially heavy metal toxicity. Heavy metals are all around us. They're way more prevalent than we think. And lead in particular is implicated, and exposure to that, it just accrues. This is why we sometimes need chelation agents, is what it's called. These go in and are able to extract heavy metals from your body and help you get rid of them and help you eliminate them. Some depression is inflammation-induced depression. Anything that increases inflammation in your body is actually going to increase inflammation in the brain by means of the hypothalamus, which is the central command center in the brain. Let's look at serotonin is a great example. Serotonin is a pleasure molecule. It helps you feel joy, it regulates your mood, it gives you feelings of calmness and relaxation. When you consume protein, one of the amino acids within protein is tryptophan. Many people talk about this around Thanksgiving. Tryptophan is found in turkey. That is one of the amino acids. It's one component of that protein. Now, it can go one of two ways. It can go in your gut, it can get converted to serotonin, which is a neurotransmitter hormone. and that leads to feelings of the calmness, relaxation, joy, and mood. And it also gets converted to melatonin, which is what helps you sleep. It's immune regulatory. It actually protects your brain. Or the other path that it could go, in people who have small intestinal bacterial overgrowth and dysbiosis in their body, it's going to lead to degradation of that tryptophan. It's going to break down and you're going to actually lose it. Therefore, it cannot go through the other path, and it's not going to turn into the serotonin or melatonin. That's a big deal when it comes to depression. If you're not having the neurotransmitters that regulate mood, it's going to lead to depression. So when it comes to brain nutrition, overall, when we avoid carbohydrates, the brain gets very happy. When you're in ketosis, there's a ketone body called BHB that is produced, and this is actually super fuel for the brain. So the fastest way to get out of depression is actually diving into ketosis, and you can notice a tremendous impact very quickly. The overall optimum brain diet, which, as I mentioned earlier, we must support this, is very nutrient dense and low carb. What does that mean? High amounts of vegetables and berries and seeds and clean meats. We're also making sure we have vitamin and mineral sufficiency. This could mean a multivitamin, but also making sure you have an abundance of these cofactors so that the processes in your body can occur properly. Additionally, the fatty acids, EPA and DHA, are very anti-inflammatory. These are the omega-3 fatty acids. Additionally, antioxidant and mitochondrial support, and protein consumption overall. If you consume more protein upstream, it's going to turn into the neurotransmitters that regulate mood downstream, so that we don't have this chronic deficit. Within 4 to 14 days, depending on the person, the neurons will respond, the architecture of your brain changes, the environment of your brain actually changes, and depression can seriously lift when we're addressing all of these factors. We got to remember, processed foods increase depression. The standard American diet increases depression. When it comes to whole foods, combining that with a balanced blood sugar, everything gets better. The brain chemistry improves, depression will lift. There's obviously other ingredients to this, but when it comes to our health, exercise is extremely anti-inflammatory for the entire body and entire body system. It helps regulate things, and it's going to increase this BDNF, which is extremely protective for the brain, and it helps your brain be more flexible and adapt better. Additionally, of course, social interaction, faith, community, sleep, exposure to sunlight, laughter, and joy in your life, challenging yourself, learning new things. All of these are components for proper brain chemistry, brain environment, but today's focus has more so been on the functional medicine type perspective of things. There's additionally nutrition and herbs that sometimes I use in practice to aid people. Minerals are very good to help alkalize things. It kind of cools the fire that's going on and cools down some of the inflammation. Niacinamide B6, like I said, B6 deficiency is prevalent in cause of depression. Foundationally, we can support the HPA axis, which is the command center for hormones within your brain. There's adaptogenic herbs that help you adapt to stress so that you're able to absorb things better and bounce back much quicker. Some of the major herbs are skullcap, St. John's wort, schisandra, and additionally something called 5-HTP is a precursor to serotonin. So that is giving you the building blocks to creating serotonin. And all of these things I recommend you actually see a physician or a holistic doctor to help get them dosed and prescribed properly. But all these things work extremely well, and it's getting to the root cause and not just throwing you on some sort of medication. The alternative to all of this is taking antidepressants, which can take like 90 to 120 days to actually kick in and have an effect. But of course, if you read the pamphlet, there's side effects to that, which would be worsening depression and suicide, which is the absolute worst thing that can happen. So also going to therapy is very beneficial. I do recommend that. Many people need to work through traumas and broken relationships that they have. I also think that being in a faith community is really important. I hope you learned something in this presentation to kind of look at depression from a new light, that there are functional approaches that can be taken. This applies to depression, but also applies to anxiety, ADHD, schizophrenia, bipolar disorder. Thank you so much for watching. Please subscribe to my channel if you learned something today. Have a great day.